My name is Dr. Neal Shonnard. I'm an orthopedic spine surgeon in Puyallup at the Rainier Orthopedic Institute. We're a division of Proliance, and Proliance is a group of surgeons across the state of Washington. There are more than 250 board-certified surgeons, and we span a large spectrum of subspecialties. There are orthopedic surgeons, spine surgeons, neurosurgeons, general surgeons, breast, urology, OBGYN are all represented as part of the Proliance Surgeons group. So many Proliance surgeons are fellowship trained. I am a fellowship trained spine surgeon, so that means I'm a year after I graduate from my residency, I spend another full year in a fellowship training program where all I do is spine. So I saw probably 1,500 to 2,000 patients. I operated on 350 to 400 in that year. And so it condenses the education that you would get in private practice over a decade into 1 year.
My friend was recently diagnosed with kyphosis. What are her treatment options?
So kyphosis is a deformity of the curve of the spine, and kyphosis can be managed non-operatively, and if it is successfully managed, nothing further need be done. If the kyphosis continues to progress and actually gets in the way of them enjoying their life, then you can surgically correct it so that the kyphosis diminishes or disappears and you go on with normal posture.
I've heard that you provide disc replacement.
That's a type of surgery that is starting to replace a 50-year-old procedure that is one of the gold standard operations. With a disc replacement, you can take care of the disc herniation and return the spine to its normal motion because the device is a motion preservation device instead of a motion elimination device. Fusion eliminates motion, disc replacement continues motion.
Can you tell me about patient-reported outcomes?
So patient-reported outcomes are a recent focus of healthcare research, and they will remain the focus of healthcare research because they address the most important thing that healthcare is designed to do. It's designed to improve the outcome of the patient. And patient-reported outcomes are the patient making the statement, this is how much better I got. In the past, medical research has been physician-reported patient outcome, and the physician has a tendency to think that if a patient comes in and says he's doing well or she's doing well, that's the truth of it. But if you actually speak with the patients, they'll tell you that I didn't tell my doctor all of what I was really worried about or all of what really affected me. And so patient-reported outcomes get you a much more accurate reporting of what the patient truly believes.
Finally, what makes you a great surgeon?
I'm blessed because I have a wonderful team. I was blessed to be in an organization that is so supportive of surgeons. The employees at Proliance Surgeons are focused on excellence, and the surgeons in Proliance Surgeons are often fellowship trained, and so they bring the highest level of education and expertise, and that causes within the colleagues of Proliance Surgeons a pursuit of excellence that is not commonly encountered anywhere else.